Back at the end of the 1990s, the prevalence of smoking amongst teenagers was about 20%. And there was a lot of concern in the public health community about that because the rate hadn't really changed much for quite a long period of time. We worked with public health practitioners to try and develop a programme which could be undertaken within secondary schools to try and discourage young people from taking up smoking.
Evidence to Impact was, we think, the first Bristol University public health spinout. Since the company was set up, over 160,000 young people have benefited from the Assist programme. So that means that around 22% of them won't have gone on to take up smoking, which is fantastic in public health terms. We genuinely felt there might be a lifespan attached to what we did because we want to be a victim of our own success in reducing the uptake of smoking. With the new vaping behaviour that we see more and more in schools and communities, we've developed content on that. What we want with young people is to give them high quality information, but we also want them to either retain the behaviour that means they're not vaping, or if they have started vaping, we want them to make better choices. So we are evolving to keep pace with tobacco companies. But for us, the next step is to add other meaty programmes on risk-taking behaviours to our portfolio, and also working with universities to support academics to build impact into their research. So working in public health through austerity and through a pandemic, that's had a huge impact on budgets and spending. If you just say, buy this product and it costs X, there's often a response that there isn't money for those types of things. But if you actually say, we can reduce the uptake of smoking or we can reduce harmful gambling, that's a far more compelling story. We've had to pivot quite significantly. So during lockdown, we actually spent probably 12 months turning a paper-based intervention into an online programme for schools that's delivered by teachers using the interactive whiteboard. And it's been an absolute joy in terms of the ease of delivery for schools. We're working with a brilliant academic from Bristol on an augmented reality mental health and wellbeing board game for young people that may go into hospital settings actually. And what we're finding is, as a company who started off with very paper-based resources, there are lots of benefits to us for working with both, because there'll always be a place for those interventions, but to engage with newer digital technologies has been challenging but really rewarding. The experience of taking Assist from a gold standard randomised control trial to a fully fledged 4-star ref case study has given us the expertise to take that further with other universities and pieces of research, and to support academics by running workshops looking at impact and how to maximise that impact, as well as helping them with business cases and market analysis so that they know in advance what the hurdles are going to be and how to overcome them.
Some people might be put off by the idea of commercialising something or being thought of as an entrepreneur, but it is important to realise that if you're going to disseminate your work, you're going to have an income stream to support that. As public health researchers, we want to make a difference. We really want to improve public health. So for us, there's huge reward in being able to make a change that people are going to benefit from.